Dear learners, welcome back after a short break. So, in the previous section, we have discussed about the lumps and the swellings, how to do the examination, and what all are the methods of palpating the lumps. As a patient is coming to you with the history of lumps, so we are particularly, although we do general examination, head to toe examination also, but when you are specifically considering the lump, so if a patient is coming with the swelling in the neck region or any history of change in the voice, then thyroid gland has to be assessed in the neck region, and you find out the history as well as you consider whether the symptoms are just happened acutely or they are in chronic in nature, and with the history you will ascertain the changes in the symptoms of the patient. And as per the National Program for Prevention and Control of Non-Communicable Diseases, the one of the objective is to identify these lumps or sign and symptoms in the early stages. So if early stages you have identified, then it is easy to do the early treatment also, and you can control the progression of the illness and you can reduce the economic burden of that disease in the patient. And with that thyroid gland I was discussing, and you have ascertained this history, and if you see the diagram also, an illustration, and you see in the neck region a clear cut swelling is visible in the neck region, so you can do the assessment, and if you are able to refer it on timely and convince the patient and do the counseling and do the regular follow-up. So after doing this thyroid gland or the neck region assessment, next is the most possible area, common area where the lumps are visible or lumps are there. Patients are having lot of problems due to this, so that area is the breast. So in that, if any lady who comes with a problem related to breast, or any lady who is above 30 years of age and comes in the center, or you come across in the hospital also with the problem, you can perform the breast examination. So you can ask the patient to undress the waist area upward and then examine the breast. So in that, because you are now dealing with the very sensitive part of the female, in which you have to expose the part. So again, you will have to keep in mind that before doing the procedure, you will have to explain the patient what is the procedure, how much will be the exposure, and why you are doing this procedure, because patient come with the problem, and sometime patient has come with some other problem, that, or it can be that you are organizing some non-communicable disease camp, and during that camp your female patients are there, and you have to keep that in mind, that you can also identify any lump in the breast, or even you can explain the patient that how they can examine their own breast at home, and how they have to examine it. So when we come to the positioning, or it can be we can do assessment when the patient is in standing position. It can also be done when the patient is lying down position. So, and it has to be done, as I have explained in the previous, by using the observation method. You observe certain changes in both the breast, or you can also do the palpation. So in how these things will be done, so we will be discussing. in detail. So when you are doing the clinical breast examination, or you are explaining the mother how she or the lady to do their own breast examination at home also, so they need to follow some systematic steps of doing the procedure. So what all steps are involved? So first of all, ask the lady to stand, because it can be done in a standing position, as I told. So you can ask her to stand in front of you with her straight. Your shoulders are straight and your arms on the hips. So in this position, lady will stand and you look at her breast. So what all you observe during this position, you check the size of both the breast, whether one breast is more in size than the other, the shape of this breast, whether both are symmetrical or there is some change in shape of one breast to the other, and the color of the skin. Sometime when the lump is present in the breast, so over that area of the skin there is change in the skin color. There is some orange peeling type of orange peel type skin will be visible on the lump side. So you have to observe very keenly, or alert. You have to remain alert for these changes in the skin of the breast, and to find out whether evenly shaped without visible distortion, or there is any swelling that can be observed. So for what all you need to know, ensure, or you need to know as a healthcare worker, that if you have some finding, so what will you do? How you will tell that patient that you need to consult the doctor. So in case of dimpling, you have observed dimpling which occurs when the skin of the breast appear to be pulled inward. You find that skin is pulled inward. So that time you can encourage the patient to go for the consultation. Puckering, you can observe like changes in the skin texture on or around the breast. That is another observation. Then bulging of the skin over the breast, the part of the breast where the lump is there, it is bulging. So an inverted nipple, another indication. Nipple are inverted and which are pushed inward. Inverted nipple means these are pushed inward instead of sticking out. So that is also an indication, and there is redness, there can be rashes or swelling of the breast. So their consultation can be given. Then now this you have observed in the standing position. Now ask her to raise her arms. Now she will, previously she was standing straight with the shoulders straight and hands down, but now in second position she is asked to raise her arms and look for the same changes again. So, and you look for any dimpling or the skin, dimpling of the skin or inward drawing of the nipples. Then again gently you will ask the mother, or you can do that, squeeze each nipple between your fingers and thumb, because it is needed for assessing if there is any discharge from the breast which is abnormal. It can be in the form of pus, or it can be a bloody discharge also. So these are the findings which are very sensitive findings, very important findings, and if it is there without any reason, then that has to be recorded. Then so this is the how the fingers are placed for assessing the discharge. Then you can ask in the laying down position, when you make the patient lie down, and then you examine the breast one by one, because there are two breasts, so one by one has to be assessed with the help of palpation method. So now you use a firm, smooth touch. First, few fingers you can use, and as I told you earlier also, that flat surface of the finger to be used for palpation rather than the tip of the fingers. And if I show you, this is the diagram, how you are going to use your fingers, not the tips, and this side where the arrows are there, that you have to do the cover the each and every portion or every part of the breast in a systematic manner. You can start from the axillary side of the one breast, and each and every area has to be palpated using these fingers, and you cover the entire breast from top to the bottom, side to side. That means you will not miss any parts, from top to bottom or from side to side, from the collarbone to the top of the abdomen, and from the armpit to the cleavages, and where the narrow spaces between a person's breast that is seen when they wear a piece of clothing, that does not cover the top of them. So you have to cover each and every area, inside, outside, top side, bottom side, and in a systematic manner, and using your surface of the fingers. So it has to be done very carefully, and not to neglect any area around the breast also, and you ensure to feel the tissues of the breast, and begin at the nipple and moving in the larger and larger circles. You can do it in a circular method, anti-clockwise, or you can top to down or side to side, until you reach the outer edge of the breast, from one side to another side of the breast. So you have to cover all the area, and also move your fingers up down vertically in the rows. Begin the examining each area just beneath the skin with a very soft touch, and then increase pressure so that you can feel the deeper tissues down to rib cage. So you have to cover every aspect of the breast, for the one breast, and then the next second breast also same way. So when your findings are there in the breast, it can be in the form of fibroadenoma, that is the lumps which are mobile, and they are also known as the breast mouse. So they are benign breast tumors. Other finding can be simple cysts. There can be lump can be of different nature. This is what I am telling. So it can be a fat necrosis. Fibroadenoma can also be there, like lumpy breast with pain. Then breast abscess can be there, and lastly the breast cancer. So these are the findings during the that lump can be, we cannot say that every lump can be the cancer. It can, different findings can be there. So but this is the early indication or early palpation by the woman or the person. So you need to do further assessment that this lump, although you have identified some lump, but it may not be cancer. So it can be fibroadenoma, fat necrosis, simple cyst, it can be abscess in the breast. So further assessment has to be done. Now there can be another lump, that is abdominal lump. So abdominal lump involves the swelling or the bulge that emerge from any area of the abdomen. So we have discussed first the neck region swelling, then second we have seen the lump in the breast, and now lumps can be there in the abdominal area also. It most often feels soft, but it may be firm depending on the underlying cause. So if a patient has a fever, vomiting or pain around an abdominal lump, along with the lump, you may need the emergency, patient may need emergency care, because it is not only the lump is important, but the additional clinical symptoms which patient is complaining. So it has to be ensured that what are the complaints with which patient has come to you. Along with that, there is history of lump also, so that has to be assessed, and depending upon the condition of the patient, if emergency decision has to be taken or patient need emergency referral, that has to be ensured. So what all are the causes of abdominal lump? Or usually the hernia causes the majority of the lumps in the abdomen. So when we say the lumps in the abdomen, they are mainly the hernias. So hernia often appears after strain on the muscles. When you are putting some strain on the muscle, it can be due to lifting something heavy. So that time it has give more pressure on the abdominal cavity and a hernia develops. It can be due to coughing for a longer period. Patient is coughing and most of the time pressure is put in the abdomen, and it can cause some. And there can be another cause, that is patient is being constipated. So here also it is important to take the history of the patient to ascertain, because patient has come with the complaint in the abdominal region. So you have to ensure whether patient was having these complaints, so that you can ensure the underlying cause of hernia. So hernia is the exit of the organ. Where the exit of the organ, it can be at the bowel site, through the walls of the abdominal cavity in which it normally resides. So hernia most commonly involved in the abdomen is the specifically in the groin region. So in the groin hernia, it could be, we say very commonly, inguinal hernia or the femoral hernia. And other hernia which include the hiatus hernia, incisional hernia, there can be umbilical hernia. So this type of hernia causes pain or discomfort, especially with the coughing and even heavy lifting. As I told, patient is doing exercises, that time also they can emerge, and going to the toilet, that time also they emerge. So often, because we put lot of pressure on certain organs, so often it gets worse throughout the day. Throughout the day, because we are doing some or the other activity, so these hernia appears mostly, and they improve when the patient lie down in the resting position. That time they are not visible. So hernia swelling become larger when patient is coughing or lifting heavy weight. So the main concern is regarding the strangulation, in which the blood supply to the part of the bowel is blocked. So if the blood supply will not be there, so it can cause the strangulation, and that is a kind of emergency, and patient needs to be sent for the surgical consultation. So there are various risk factors. Here you need to know these risk factors, because as a health workers, when you are meeting this patient, you can make them alert that if they are doing smoking, it can lead to hernia, or it has led them to occurrence of hernia also. Patient is having problem of chronic obstructive pulmonary disease or history of obesity, in case of pregnancy also, there is lot of pressure, lot of changes in the blood supply and major structures of the female. So during pregnancy also, a woman can have umbilical hernia or any hernia. Peritoneal dialysis is the another. Patients are undergoing regular peritoneal dialysis where there is risk of developing hernia also. Then collagen vascular diseases or the previous open appendectomy. If the patient has history of previous open appendectomy, that can also lead to hernias. So these are the even genetic is also one of the risk factor. So there are many types of hernias, so we may not go in much detail, but reducible hernia is the hernia which may appear as a new lump in the groin or other abdominal area, and they may cause pain, but it is not tender when touched. So it can have pain, but when you are doing the palpation, that time it may not be tender. So it is reducible, which disappear. So sometime pain proceed with the discovery of the lump, and the lump increases in the size when the patient is standing or when there is pressure in the abdominal region due to coughing. So that time it is visible, it comes out, you can say, in layman term, and may be reduced, pushed back into the abdomen unless very large. If it is not very large, it will not be visible also. So this kind is reducible hernia. Then there is another type, that is irreducible hernia. So occasionally the painful enlargement of a previously reducible hernia. So the hernia which was reducible, which was not visible, now if it gets enlarged. So if it over a period of time it may get enlarged and it becomes more painful, that cannot be returned into the abdominal cavity, which do not return back. So on its own, then it is called irreducible hernia. We are not able to reduce the size of the hernia. It can be chronic, which has occurred over a long term without any pain. So irreducible hernia is also known as an incarcerated hernia, and it can lead to strangulation as the blood supply being cut off to the tissues, and that is why patient is having if it is painful or when there is no it does not reduce in the size, and associated symptom can also be there, that is nausea and vomiting. So the other type of hernia is the strangulated hernia. So this is an again irreducible hernia in which the blood supply to the trapped tissues in the intestine is cut off. There is no blood supply and pain is always present, and patient will complain of pain and followed quickly by the tenderness also there, and sometimes symptoms of bowel obstruction and nausea and vomiting will be there. The affected person may appear ill with or without fever, and this condition is a surgical emergency. If the patient is complaining these along with pain, the vomiting and the nausea and fever also sometimes, so it has to be removed surgically or patient needs surgical consultation. So when you are doing the an inspection, again as I have told in the previous session, that your method of examination will remain inspection, you will be doing the palpation, so same you have to do in the case of abdominal hernia also. You will inspect, you will do the looking for the obvious skin changes, swelling or any lumps that may be relevant, and ask the patient to look over their shoulder and cuff so that they do not cough on your face, and during the coughing, look at the lump to see if there is a coughing impulse, and with the cough you can see the bulging and ensure. You also do the palpation to assess the swelling and to find out that various findings as per the palpation, whether it is soft, it is pulsatile, and ask the patient again to cough and palpate for a cough impulse, and ensure that you feel the opposite side. And bilateral hernia are very common, and often one being much more prominent. So you can compare if it is multiple. You also can do auscultation and inspection, and there are so many other umbilical hernia is also there, which is similar to inguinal hernia and more localized, and it occurs around the navel. When the location of the hernia is around the navels, then it is called umbilical hernia, and mostly this is common in the babies and will often disappear after as their abdominal walls heal. So surgery may or may not be required. So there are many incisional hernia, then there are even lymph node enlargements. So these are all the lumps which need to be examined using various methods, and your feeling can be assessed the abscess, and all these are important findings which are required for the early identification and diagnosis of the patient to give the early treatment and to prevent the patient from various further complications. And with this, we come to the end of this session. Thank you very much for patient listening. Thank you.